We're preparing to live stream now. So everybody, please be aware, we're live streaming.
Good evening. Thank you to our families and our community for joining us this evening for a community conversation hosted by Hartford Parent University as we discuss Hartford Public Schools' Return to Learn plan. We are in unprecedented times, and the start of this school year will look different than any other. In prior weeks, town halls were held for our families, staff members, and community partners. During those town halls, vital information has been shared related to the reopening of schools. But tonight we will take a closer look at the part of our plan related to health and safety. Please welcome Dr. Leslie Torres Rodriguez, the Superintendent of Schools, and Deborah Bigelow, Program Coordinator for Hartford Parent University.
Good evening, everyone. Welcome to our community conversation about health and safety. I want to also express our gratitude to Ms. Deborah Bigelow and our partners at Hartford Parent University for hosting this conversation. We are hoping to get a little closer into and examine what the return to learn is gonna look like, sound like, and feel like from a health and safety perspective. And we hope that after we get through the presentation, we can answer very specific questions and engage in some dialogue. Know that at Hartford Public Schools, we have been working really hard to make sure that we plan with a lot of care and a lot of thought as we return to school, either right in person or remotely. So we will continue to do that because we are committed to each and every one of our students, our families, our staff, our partners. And we are committed to taking care of one another and being flexible while knowing that this is a challenging time for everyone. So I want to thank you all for joining us. And before I begin my presentation, I'd like to see if our partners at Hartford Parent University, Ms. Deb Bigelow has anything that she would like to say to us.
Good evening, everyone. I'd first like to thank Dr. Leslie Torres for allowing us to host this. We at Hartford Parent University um, look forward to working in collaboration with Hartford Public Schools to do whatever necessary to make sure that our children get the quality education that they need and will safely return back to school. Thank you.
Thank you. And just to highlight the conversation, the objectives, the agenda for the conversation is a review of our Return to Learn plan, the schedule, why it was that we decided on this way, these models to open the school, and then, of course, get into the health and safety specifics. We hope to have a future conversation that is going to look at other aspects of our plan. So we can begin with our presentation. We wanted to make sure that we developed a plan that was informed by what our community is telling us, by what our staff are telling us, by what our families are telling us about the needs that they have. And so in our last survey, which specifically asked our parents, our families, our caregivers about the learning preferences, we wanted to show you what the responses were. We have about 18,000 students in Hartford Public Schools. And so we are grateful that we have received about 15,000 responses. And as you can see there, what that looks like is that if you look to your left, 82% of our families have responded. And then if you look to your right, what we can see here in the blue is that 33% of our students and their families have selected the learning preference that is in-person learning in our schools. And the majority thus far, 49%, have preferred to learn remotely. So what I will do now is explain how it is that we are using this information with the information that we are monitoring very closely, which is the COVID-related information. Some of you have seen this image before, this table. This is our decision meter. It's to help us make shifts in teaching and learning and what teaching and learning is going to look like and where teaching and learning is going to happen. And this is very important for us to look at and understand, because we know that we can't just plan for one way, one scenario. We know that the COVID pandemic is very fluid. That means it can shift rapidly. And so we want to make sure that we identify how we're going to change, when we're going to change, and what that's going to mean for our students and for our families and for our staff. And so to the left, we see where it's the external health conditions. And that is another way of saying what exactly is happening with the COVID situation. And so we are monitoring the rates of COVID, the positive levels for COVID testing that people are having. And we have, as you can see, from green all the way to red. And depending on where the numbers are, that's going to help determine the changes that we have to make. Today, as of today, we are in the yellow category. That means that the COVID levels are moderate and controlled. So there are, within the last 7 days, anywhere from 1 to less than 10 cases, positive cases, per every 100,000 people in the Hartford County. Now, if those numbers shift, it could go to green if those numbers go down, but if the numbers go above 10, then we shift to an orange state. And I'll explain what that means in the next slide. Oh, before I go to that part, the two options, one is in-person learning as much as possible. And depending on that color shift, because of COVID, we would potentially could change to a hybrid model. And I'll explain what that is in a brief moment. Option A, which is starting with in-person learning, if that is what the family chooses, this is best for creating community, building relationships between students, their friends, students and staff, and also for student engagement. We heard a lot throughout the spring and even throughout the summer that some of our students were telling us and telling our families that they really missed being in school and that they just didn't feel like they wanted to engage with their learning. And so if that is something that is a concern for you and or your child, you might want to consider option A. Option B is part of learning remotely, learning online. And this is part of a group of students that will learn together with a teacher from their school. It will happen online. And this is best for students who cannot attend in person for whatever reason it is. If the family feels like they're better served learning remotely during this challenging time, or if the parent feels that they have a level of concern about safety for any reason, then this potentially could be the best option for the family and for the student. So now we can look at what does being in the yellow column mean for students and the way they are going to learn. So current status is yellow. So you can see below the yellow that pre-K9 through pre-K through ninth grade are going to be fully in person. There's always the option for a family to say, I want to stay online, learn online. And so we're giving the option for fully in person for grades pre-K9 every single day, as you can see there. Monday through Friday, pre-K through 9, those that have chosen option A, that the option to be in school, would come to school every day. On Wednesdays, however, every Wednesday, it would be a half a day. This allows us to have time for professional learning for our staff and for additional cleaning that would happen. However, for students in 10th through 12th grade, we are going to have a hybrid model. And that means that the grade would be split into two groups that will come to school at different times. So one group would come to school Monday and Tuesday. And then for the rest of the week, they will learn at a distance, remotely. And then we swap, we flip. The other group would come to school on the other days, and the other 3 days they would learn remotely. So some questions have come up as to, well, why not everyone learning every single day, or why not everyone learning remotely? So it is, we had to think about the guidance that the State Department of Education, the state health officials, the local health officials were providing us. And essentially the guidance says that one of the ways in which we can mitigate or reduce or prevent spreading of the illness is by having students in cohorts. That means in the same groups traveling together. It is easier to do that in earlier grades, in the lower grades, from pre-K through ninth grade. Some of you know, if you have students in high school, or if you remember to some of your high school days, in high school, the classes that you have depend on the credits that you have to take in order to graduate. So it becomes a little more tricky to keep students in those cohorts. That is why we decided to have 10th through 12th grade at separate times. And so that is the yellow. However, if we have to shift, and you saw what happened in the spring, it was a quick time, it was quickly that we had to shift, right, to being remote. If we do have to shift, you see now over to the orange what would happen, and that is that the students that were learning in school every single day, those pre-K through 9, they then have to go to a hybrid model, and then the 10th through 12th grade, they have to learn online. If things fully change and we have to go to a red, which means that it is a very challenging, uncontrolled situation with COVID, then everyone goes to remote and online learning. But as of where we are today, and what we are planning for is for the conditions and the learning models under the yellow column. We do often get the questions about what's going to happen with students that have different needs and different ways of learning. And so we want to make sure that we communicate our commitment and our plan to meet the needs of our students, all of our students with exceptionalities or special education students. There's a lot of work that's happening now with our special education teachers, our case managers, our special education directors, our speech therapists, our occupational therapists, to make sure that we are monitoring the service, the implementation of the student's individualized plan, and that we do so in a way that connects and remains connected to the family. So we're expecting that communication only gets better as we go back into this new way of learning for our students. English learners, we know that we learned in the spring that many of our parents of English learners expressed concern because students had difficulty at times accessing the learning. And so each student will have a language acquisition plan for that clearly states what their level of support is. And our support staff are teachers that are trained on supporting students that are learning English, are going to provide those supports. We also are very mindful of our disengaged students. If some of you remember, we had students that were not coming to school on a regular basis, or students that were almost, close to being fully disengaged. And so there's a lot of personalized outreach. We are doing a lot of outreach with our families, with our students, to just keep them connected. This is where our community partners, who I know are joining us this evening, are so important, because we know that there are times in which our families have other needs that we might not be aware of in the school. And so it is so important to us to maintain the partnerships, because you all, our community partners, can help us support our families better. And then, of course, our homeless students. Unfortunately, we do have students that and families that are considered homeless. And so we want to make sure that we remain connected and committed to providing, whether it is the transportation, uniforms, any supplies that are necessary, so that our students can stay connected to their learning and connected to the community, the school community. So I know that there's a slide that is gonna highlight some of the safety. But while John is queuing up that slide, Ms. Deb, do you have a few questions that perhaps we can answer until we get the other slides up? Ms. Deb, I can't hear you.
I didn't unmute myself. I'm sorry. One of the main questions that we're getting from our parents is, will staff and students have to go through a temperature check prior to entering school. That was one. And the other one that I got mostly from our parents is, will there be monitors on the bus to ensure that the kids that are coming into the schools, taking the bus, that they have their masks?
Great questions. So in terms of the temperatures, we are going to rely on our families. If you, perhaps you are aware, perhaps you're not aware, we did get 4,000 smart thermometers that we are going to have available to our families, so that we can join in this effort together. This is, a community approach to making sure that we all are taking care of ourselves and one another. And so we're asking our families to be very, very mindful and vigilant of any symptoms that are potentially happening every single day. And we're doing the same with our staff. We do have technology that we are going to share with our staff in the very near future, so that staff can record, their potential symptoms on a daily basis. The question, Deb, with regard to bus monitors, we are going to have bus monitors. We are in the process now, as you know, as we continue to learn the learning preferences, it allows us to determine who is going to need transportation. And so once we have all of that information, we'll be able to determine which buses would need a bus monitor. And let me explain that, because I can imagine someone saying, well, why not all buses? But we know that we have some buses that only have 4 students, for example, right, on the bus. And so that might not be the need for a bus monitor on a bus with 4 students might not be as big as a bus, that has 20 students, for example.
Okay.
So the answer to that, Miss Deb, is yes.
Yes. Okay. Okay.
So we can go back to this one, and then we'll switch back to a question, because I might be able to answer some of the questions, Miss Deb, as I go through this image here, this slide. So it is a lot of information, but I want to just make sure that I walk through it. So if you follow me to the left of the table, where it says minimizing contact, and I spoke a little bit about this earlier, where I used the word cohorting, or keeping students in groups. Already we know that in some of our classrooms, the number of students is going to be smaller than usual. We are in the yellow, and so the guidance from the state is that to the extent possible, we maintain the 6 feet of distancing. That might be possible in many of our classrooms, because already you saw earlier in the slides that about 50% of our students are going to learn remotely. However, it might not be possible in some classrooms. So we have to think about, how can we minimize the contact? So we talked about students in smaller groups. We also are having the workstations, our desks, any tables removed and distanced to the extent possible. One-way foot traffic patterns in hallways and stairwells. There was a group of us from central office just today. We were deployed in our schools. We'll be back to schools tomorrow, doing what we call walkthroughs, and that is walking through our schools and looking through the lens, right? We were wearing, our eyes were looking for the things that we're talking about here on this slide. What does the distancing look like? What does the playground look like? What does the entrance look like? Is the signage on the walls clear as to what door belongs to which group of students? And so all of those to minimize contact, and of course, physical distancing on buses as well, to the extent possible. The second column over, where it says cleaning and disinfecting, we are going to clean school buildings and high touch areas more frequently now than ever. School buildings, daily cleaning, and then the high touch areas several hours, several times a day. So high touch areas, desks, doorknobs, let's see, outside when students perhaps are lining up and might lean against the wall. So high touch areas several times. And then buses will be cleaned after each trip. We use our buses 3 times in the morning. Each bus does has 3 different routes. And so that's 3 sets of students in the morning and then again in the afternoon. And so after each bus, there will be cleaning. I know there's a lot of conversations about questions about the masks. This might be one of the questions, Ms. Deb. And so in the middle of this table here where it says preventive strategies, we are requiring all students and staff in schools to wear masks. Where we are right now is that is the exception for pre-K students. I understand that there is still a lot of conversation and that there might be different guidance that might come to us from the state and the Office of Early Childhood with regard to pre-K and wearing masks. But where we are today is that pre-K will not be wearing masks. We are going to provide masks and shields to all teachers and staff. We have reusable masks, we have disposable masks, and we're going to make those available to and to students as well, the reusable and disposable masks. We have signage reminding everyone, and this is where your help is so important, reminding everyone to wash hands frequently and wear the face coverings. We have to be comfortable reminding one another. If we see someone that, has the mask that is below the nose or, in the chin area, the expectation is for the masks to be over the nose at all times, except when there are mask breaks. And we are going to have mask breaks, several throughout the day. What is going to be communicated as an expectation is that there is at least one mask break every, at least one 5-minute break for the mask every hour. A teacher can determine that they're going to have a longer mask break, but the expectation is at least every hour. And what that could look like is that if there is a classroom in which there's enough spacing, they can have a mask break in the classroom, or they can go outside to have a mask break. Moving over to student meals, we thought a lot about this, and we are having the pre-K students and the pre-K through first grade receive meals in the classrooms. And then the older students, beginning in 2nd grade through 12th grade, will receive the meals in the cafeteria with physical distancing in the cafeteria. We know that some of our schools are already planning to have what they call overflow space for students to either have lunch in the gymnasium or have lunch outside if it's possible with the weather. So the last area here that I want to highlight is the monitoring, which Ms. Deb, you asked a question about that. We do want to have records of our students that report symptoms that might be related to COVID. And so our nurses, our school nurses who are doing a great amount of work getting ready, are going to record for students. We're going to ask, we have, actually we're in the process of hiring now a contact tracing nurse. It's a new position for the district that is going to be focused solely on supporting the school teams. Each school is going to have a safety, health and safety team. That team is going to be supported by our coordinator of health services and this new, the nurse that we're going to bring on board. to help us keep track of not only people that might show symptoms, but people that have actually had confirmed positive for COVID. And like I mentioned before, the self-screening technology for our staff that is expected every single day. It's an application, it's an app, and we're expecting staff to report every single day as well. I know that it's not written on this one slide, but we've been receiving questions about testing, and we are not requiring testing. However, I do want to remind everyone that there are multiple testing locations, certainly throughout Hartford, many of which are free. And so we will be making that information also available to our families and our staff. So I'll stop there, Ms. Deb, and I will turn it over to you potentially for, let's see what other questions we have.
You basically answered all the questions that I had, that the parents had given me. The only one, excuse me, the only one I didn't hear about was how are you going to proper ventilate the schools so that air exchange gets in there?
Great question. And now that you say that, we should probably add that to this slide here, because it is one, Ms. Deb, that continues to come up. I know that we are going to send home a one pager that has all of these things, and it does include information about the ventilation. Yes, we have been monitoring the guidance that the state and the Department of Public Health has shared, and our systems are actually probably already done. I can certainly confirm in terms of the air filters, they have been changed and updated for a higher grade in terms of the filters. And we also wanted to consult with a group of experts, of engineers. And so we are looking forward to learning what they're going to, tell us. I know that we already looked at all of the guidance and made sure that we took care of that, but we wanted to go a little step further because we have 40 facilities, and they weren't all built at the same time. They all don't have the same system, and so we want to make sure that we look at every one of them individually.
I want to say one more question. That I had a parent that has a child that has special needs, and her question was, what would the social distance be like, because her child has a para? So if she sends her child back to school, if she opts to send her child back, how would that look? How would that social distancing look between her child and the para?
We would have to look, Ms. Deb, at the plan, the student's plan, and try to identify the best way that the plan can be implemented in the way that is, most safe. The thing there is, I think about the cohorting, right? So when you're with the same people over time, that is considered to, and everyone is taking the precautions, that is considered to be a mitigation strategy. And so we will have to look at how could the support be provided in a way that's most safe. I know that some of our students require, some of our students that do have a para educator, that is a one-to-one, what we know to be a one-to-one, that they have to at times be closer, right? Because there's a certain level of support that a student might need. So those are very individual cases that we look at to make sure that the family and the student and the para engage in conversation as to what is best for everyone. Great, that was a great question.
you. Well, your presentation, by the way, which was great, answered all the questions that I got in from my that I received from the parents. I will get this information out to them, to the coaches, so that they can filter it out to their parents. I have no other questions because you basically, like I said in your presentation, answered most of them, you know, with the exception of the air ventilation and the special needs. So.
Great. I'm going to turn it over to see if we have any questions from our live feed. I know that was an option for some of our viewers. And so if there are any questions, I can be available to answer those.
Good evening. This is Tiffany Walton. There are some questions in the live feed. The first one is asking about a hybrid option. So one parent is requesting more information about why there wasn't a hybrid option in the survey.
Yes, I appreciate that question. Early on, we did have that option. If you recall, the first survey that went on earlier in midsummer did have 3 options. And it's because that's what the State Department of Education was requiring for us to develop 3 models. And essentially what we saw is that it was a third, a third, a third. And when we got to look deeper, we realized that we just didn't have the staff. We didn't have the staff to do all 3 and to do those 3 well. And so we had to make a decision to offer the in-person Monday through Friday and the option for learning every day at home, and then the hybrid for the older grades. But that was initially the plan. It just was not, we were not able to do it.
Another parent is requesting additional information about recess and outside time. So will it be available? And if so, how will it look?
Will it be available and?
How will it look? Like, how will students be situated outside if recess does happen?
Yes, I will tell you that as I mentioned before, we were visiting schools today, and the playgrounds are going to look very different than they did before. They will be blocked off, and so students will not be able to access the playscapes. There will be space, but we are going to do a lot of work with our students to encourage the distancing, and it's going to take a lot of learning for all of us. There might be decisions that we have to make to limit the amount of either the amount of time or shorter time frames, or that we work really hard with our students to stay in much smaller groups. Great question. And that will also depend by grade level, right? We know that some of our older students might be able to respond to the request to stay distance versus some of our younger learners, because that's what they do. They need to move and they need to play, and they want to do so with their friends. So we are mindful of that, and we continue to think about what that's going to look like and what is best and safe for our students.
A question is being asked about students who are stuck outside of the US. So this question reads, can the students stuck outside the US join the online classes?
Great question. Yes, students that are, I'm assuming, I'm going to make an assumption that those are students that are registered in Hartford Public Schools. And if they're not registered in Hartford Public Schools, they would have to contact our Welcome Center and Choice Office to register. But if this is a question related to students that were our students last year and are in another outside of the country, yes, please. We want our students to engage with our learning. Absolutely.
Okay. Another question reads, why do some teachers need to teach distant learning from the school building instead of in their homes?
That is something that we're still working out. We want to make sure that if there is a need that happens in the school building, that that staff is there and we're able to shift if necessary. There's also an opportunity to really have collaboration to the extent possible. And so there are a variety of reasons why that is where we are at this moment in terms of our decision making. I know that principals are working really, really hard to develop the staffing rosters and the student rosters with our teachers.
Okay. Another question reads, how many students would be in each classroom?
So that is still undetermined because we are in the yellow, right? In the yellow, the guidance that has been provided is that we try to have as much physical distancing as possible. And so we are going to try to get to the physical distancing, but it might look very different from classroom to classroom. If we shift over to the orange, then we will have to be more explicit with the 6 feet of distancing. We are working now to get as much physical distance as possible, but at this point, and because families are still choosing an option, it's really hard for us to say that there's a specific number in a specific class. I will tell you that I was visiting another school yesterday, and the conversation with the principal, I learned that the smallest number of students in an in-person classroom is 4, and then the highest number is 14. That was yesterday at one of our schools. So it varies.
Okay. So I'm being told that we have time for one more question. So this question is a 2-part question. So it reads, what are the protocols for anyone in school with symptoms?
Our health and safety team is finalizing the protocol in collaboration with the city's director of health services. And right now, students will go to the school nurse, and a conversation, of course, will happen with the student and an assessment, and students will have to get picked up at home. We are still trying to determine what the different levels with regard to the symptoms, right? We know that flu season will be coming also. And so is it the flu? Is it COVID? We know that, it is important for families to keep us informed as quickly as possible of any symptoms. And so we also encourage our families to get tested if that's of interest to you all. Please know that there are a variety of locations throughout the city, but the protocol is going to be that students will have to go to the nurse, and the parent will be contacted for a pickup, and then additional conversation, going to the doctor, seeing the doctor, getting to know whether or not the student is it COVID? Is it the flu? Is it some other type of virus? And so it will require constant communication and quick communication from everyone involved.
Okay. And as an add-on to that question, the question is regarding the anticipation of the first day of school. So it reads, is the school going to require or enforce that students who went out of the state to travel ban states in the last 2 weeks before school, will they have to quarantine before starting?
So we are hopeful that our families, if that has been the case, that they follow through on that. And it's hard for us to know whether or not families have been out. it's hard for us to know whether or not staff have been out. And so we are, the expectation is that everyone is working together to keep themselves, their loved ones, and ourselves safe. And so it is our hope that if that is the case, that a family is communicating with us to let us know that they have to quarantine.
Okay, I believe this is our time for the questions.
Thank you, everyone, for such great questions. I'll turn it over to Ms. Nushet Blackburk to send us off for the evening so that we can go and do a Spanish conversation.
Thank you, Dr. Torres Rodriguez, and thank you, Ms. Bigelow, for hosting this great conversation. This is exactly what we wanted to do, to hear from our community and to have a time for dialogue. So with that said, thank you. This has been recorded. It will be posted on our district website. If you have additional questions as it relates to our Return to Learn plan, please visit our district website or feel free to call our Welcome Center at 860-695-8400. Thank you. Stay well, be safe. And if you are joining us for an in-person option, we will begin September 8th. And please take notice of any additional information that comes to you from your school that will give you very clear directions on that staggered first week of school. Thank you and have a great rest of the day.